this video, we are going to follow up the topic of the lecture in this week and talk about 3 principles of the experimental designs. So these principles are coming out of the 3 important challenges that have been shown up in the study designs. So let's take a look at those challenges at first. The first challenge has been already mentioned in the class, which is the confounding effect. When confounding effect appeared, the association between the exposure and the outcome will be distorted when the primary exposure of the interest is mixed up with some other factor that is associated with the outcome, which is the status of the walking cat in this case. Besides the Cheetos example we discussed in the class, here is another example about the confounding. As we all know, the COVID-19 is widely spread in both United States and Canada. However, the death rate of COVID-19 is different in these 2 countries, where the United States has just 2.8% of the deaths, while the death rate of Canada is over 5%. Based on this result, one might draw a conclusion that the United States did a much better job in curing the patients of COVID-19 and save a lot of lives. However, this conclusion is in fact confounded by another factor, which is age. It is well known that the older people has much higher risk than the younger population. If we look at the age structure of the 2 countries, we can see a large difference. Almost 30% individuals in Canada who diagnosed with COVID are elder people, while this percentage in United States is just 10%. Therefore, the association between the fatality rate and 2 countries might be fake due to the confounding effect of the age. Another type of challenge is the measurement error, which is defined as the difference between the measured quantity and its true value. For example, when we measure Cheetos distance, we rely on the readings on the Apple Watch. Due to the technical error, this reading might be more or less than the actual distance of the walk. So in reality, the measurement error is usually regarded as unavoidable because there's a lot of way we can see some measurement error in the readings. The third type of challenge is the placebo effect. Say, we are interested in whether a medicine is effective or not in treating the disease. When conducting the randomized trial, we randomly assign our patients into 2 groups, the treatment group and the control group. We give the treatment group the medicine and the control group nothing, and to see if they are getting better soon. However, this design is problematic because these 2 groups are not exactly comparable. Even if the treatment is not effective, the treatment group might be in a better mental status in that they know they are being treated, whereas the patients in the control group will have a very negative mental status because they know they are getting nothing. So the mental status might influence the recovery of the patients from the disease, and hence here this mental disease could be our confounding factor. Now, as you see, there's a lot of challenges when we design our study designs. And to tackle the problem of the study designs arising from these challenges, there have been 3 different principles of the experimental design proposed. The first principle, which you might be already familiar with, is the randomization. By randomizing different treatments to the cat, we break the relationship between the brands of the cat food and the walking status of the cat. So in this way, we know that the association between our exposure and our outcome are the real associations rather than out of the confounding effect. There are other methods to solve the problems of the confounding effects, such as the blocking and the matching. In blocking, we group the cats according to whether they are walked by their owner or not, and then we conduct the randomization therein. And the matching can be regarded as a special type of the blocking, in that each match pair is a block, and we randomly assign one individual of the pair into the treatment group and another one to the control group. The second challenge is the measurement error, and we know that measurement error is almost unavoidable. To reduce the influence resulting from the measurement error, one method that can apply is the application. For example, since the measurement of the distance might have some error, then you can wear multiple Apple Watches instead of just one Apple Watch when walking the cat. Of course, this approach might be expensive, and in reality, a more frequently used method for the replication is to increase the sample size. For example, you can repeatedly walk the cats on each day of the month to collect a large number of the data. Or you can invite your friend who also has an Apple Watch to walk another cat together with you. So why taking replicates will help us to get rid of the measurement error? Remember, each measurement is more or less different from the true value. However, if we take the mean of these values, their difference to the true value will be cancelled out, and the mean is very close to the true value. The third principle is to take control. To determine whether a drug or medicine has an effect, we need to know what would have happened to the response variable if the treatment had not been applied. To find that out, experimenters create control groups, which are handled identically to the treatment groups in all aspects, except that they don't receive the active treatment. The control group ensures that no unexpected influences on our response variable will occur in the experiment. Finally, to deal with the placebo effect, we would need to consider a special type of control. For example, for the control group of the study, instead of giving them nothing, we can give them a pill that looks just like the medicine in the treatment group, but does not have any effect at all. Therefore, the patients in the control group will not know which group they are in, such that their mental status will not be affected. Meanwhile, we tell the patients in the treatment group that their pill could be effective or ineffective, so that they don't know which group they are in either. Here, the pill that is not effective is also called placebo, referring to a substance or treatment which is designed to have no therapeutic value. By introducing a placebo, we blind the patients such that they don't know which group they are in, so this technique is also called blinding. Sometimes we will also blind not only the patients, but also the researchers, so that the patients cannot tell which group they are in, according to researchers' reaction. We might also blind the analysts, so they will have no idea about which group is which, and they will not try to make one group works better than the another one, either purposely or unpurposely. So this type of design is also called a double-blinded experiment. Okay, so that is for this week, and I'll see you next week.